Vitamin D is not a vitamin, it is a hormone, and a really important hormone for women because it's really important for breast and pelvic floor health and bone health. So back in the day when they figured out vitamin D, they were finding vitamins and it was next on deck. So it got called vitamin D. But vitamin D isn't a vitamin, it's a hormone. And I will never forget the article that I read that said vitamin D helps pelvic floor pain and tension and all this tone. And since I learned that vitamin D isn't just a vitamin, it's a hormone, and when your levels look good in your blood work, so say it's like 40, 45 and you're in the green in your blood work on the app, that's not optimal. That's not optimal. And like, you need to be the best version of you as you age because we just don't have as much wiggle room. So when I'm talking about vitamin D, I say vitamin, but I want people to know it's a hormone because it's like super popular. It's super important. A, D, E, and K are fat soluble vitamins. And so when I talk about that, even though it's a hormone, I take a very high level of vitamin D, but I get my blood work checked every 3 to 6 months because I don't want a high toxicity. But the way I process vitamin D, I suck. So I have to take 10,000 IU of D with K2 in a liquid form. I have finally found something that works for me, and it is slowly creeping my numbers up. I am now like 44, which is like freaking amazing for me, and it's still like garbage. My goal is like 50 to 70. If I can get into the 50s, I would be super pumped. But vitamin D is so, so important. And I also think people are afraid to try different types of vitamin D supplements and see if your supplement is actually working for you. So sometimes the vitamin D supplements my patients are taking are too low. Sometimes it is not D3, it's D2, which is not as effective. Sometimes they don't take it with K. There's a host of things. So I just always want people to know how important it is for breast, vaginal, pelvic floor, and bone health. And I personally take an exceptionally high dose because I am a weirdo and I just don't process it. But the only reason I know that is because I did my blood work, and it is oftentimes not covered by insurance. So I feel like people don't order it. So I always ask, and I could go to CompuNet or LabCorp here in Dayton, Ohio, and get my D tested without having to have a doctor's prescription because it's not covered. So I spend like $25, and it's well worth it to me because having my D levels optimal could help my joint pain, my fatigue, and I'm really trying to gain muscle bulk so that each year I don't keep losing. I am really trying to gain. But that's what I mean. It's kind of a weird thing.